Recording in progress.
نبدأ. Very good morning, and thank you for joining us in the official inauguration for the first cohort of the Regional Professional Diploma in Family Medicine, which actually present one of the several successful collaboration with primary healthcare partners in our region. My name is Hassan Salah, primary healthcare regional advisor and the team lead for access to health service, and the moderator for the next 90 minutes. We'll start with opening messages from the primary healthcare partners who developed the diploma, and this will follow with 2 sessions. Participants have an access to Slido for the comments and the feedback, and there will be a session to answer your questions. And then we'll end our events with closing remarks. Let us start with the opening remarks from Dr. Ahmed El-Mandari, Regional Director for the WHO Eastern Mediterranean Regional Office. Dr. Ahmed, the floor is yours, sir.
Thank you very much, Hassan. Much appreciated for organizing this important gathering. Looking forward, to have a successful first step, inshallah. Distinguished colleagues, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning and good afternoon. It is a great pleasure to join you today for the inauguration, the first cohort of the Regional Professional Diploma in Family Medicine. This much needed new study program aims to promote family medicine or family practice and is the result of the commitment and successful collaboration of WHO with many organizations, including the Arab Board of Health Specializations, the UN AIDS, the UNFPA, UNHCR, UNICEF, and the World Organization of Family Doctors. I would like to welcome colleagues from our partner organizations, namely Professor Omar Al-Rawas, Secretary General of the Arab Board of Health Specializations, Dr. Karina Narsisian, Deputy Regional Director of UNPA's Arab States Regional Office, Ms. Rachel Manning, Strategic Partnership Advisor, UNHCR MENA Bureau, Mr. Bernard Bainville, Deputy Regional Director for UNICEF Middle East and North Africa region, and Dr. Taghreed Farhat, the World Organization of Family Doctors, Regional President for the Eastern Mediterranean. I would like to also thank them for dedicating their time and efforts in supporting this program. Strengthening primary healthcare through the family medicine practice or family medicine practice-based model of care is essential for achieving universal health coverage. However, the shortage of family practitioners worldwide in most of countries of the WHO Eastern Mediterranean region presents a real challenge. To overcome this shortage, this 2-year regional professional diploma in family medicine has been launched as a bridging program to equip general practitioners who have not had the needed additional post-medical school training with the knowledge and skills required to provide comprehensive, continuous, and appropriate healthcare to individuals and families. Dear colleagues and dear candidates, I'd like to take this opportunity to congratulate you to joining the Regional Professional Diploma Program. Upon completion of the 2-year program, you will have gained a solid knowledge of family medicine, and new study and career opportunities will be open to you as well. I would especially like to thank the Arab Board of Health Specializations for supporting the program through the participation of their regional experts and their extensive network of accredited training centers, and for their efforts in helping to standardize the diploma to meet regulatory requirements and ensure better career progression. We are looking forward to supporting the successful implementation of the professional diploma in family medicine to help reach our goal of 3 family physicians per 10,000 population in the region. This is, in turn, will definitely help us to achieve our regional vision of health for all by all that we have been working for the last 4 years. And I'm sure, inshallah, together we will be able to succeed. Again, thank you very much, dear colleagues, for allowing us to work together with you and turn this sort of dream that have been there for many years in the past, turn it into a fact on the ground. And I'd like also to ask my dear colleagues, the candidates who are enrolled in this important program. It is a golden opportunity for you, colleagues. Please make use of it. We are all around you. We are all with you to support you and make sure that you will succeed in this 2 years program. And then you will also take it further for another, whatever career directions that you would like to take in order to make sure that you are really well equipped, as I said, in terms of knowledge and skill and wisdom, taking family medicine or family practice forward to serve your citizens, your communities, your people here in the region and beyond. So thank you very much, Hassan. Back to you. Jazakallah khair.
Thank you, Dr. Ahmed. Thank you very much. The next message is from Dr. Omar Rawaz, Secretary General, Arab Board of Health Specialization. Dr. Rawaz, the floor is yours, sir.
Thank you, Dr. Hassan. Dear Dr. Ahmed Al-Manzari, dear colleagues, dignitaries, and also candidates, it is my pleasure to be with you today in this very important event, the inauguration of the Regional Professional Diploma in Family Medicine. And first, I would like to congratulate you all for this achievement. Actually, to be able to start this program is in itself an achievement. And hopefully when we get the first group, this will be another milestone, graduating and so on. I am here to first to thank everybody involved in the initiation of this program and making it ready to be implemented, starting from the WHO EMRO office with all the teams and especially the joint committee between the WHO and the Arab Board. Also in the scientific committee, especially formed for this program, the international office in the Arab Board, the family medicine scientific council in the Arab Board, and all the countries that have actively get involved in the program. We believe this program will help bridge the gap between what we want as a full-fledged family medicine practitioner and general practitioner. And we will be having, hopefully with the aim, we'll be having general practitioners who are well informed and ready to become full-fledged family medicine at a later time. As you know, the Arab Board started in '78, and now we have 59 programs and specialty programs between residency programs and fellowship programs. And I can tell you, this program has taken the most and dedication and efforts to make sure that it starts right and to be sustainable. All the other programs, they go through the already established template, but this is a little different. But we might want to make sure it doesn't lag behind. So my apologies for those who wanted to start faster or earlier. I think we reached the right time and we reached also the target. I remember when we started saying we want to target 150. And then we said we could take up to 250. So I considered that our aim for the first year is between 150 to 250. And I had been briefed today that the candidates who were supported by their government to enroll in this program reach above 200 by today. So, and this is very good news for us. It is good to start good number, but not too good, not to be not too big, not to be managed, or too small, not to be really cost effective. So I think 200 plus is a very good start. Especially all of these are communicated to us through their governments. We have many applicants, but many of these applicants are in places where there is no training centers, or there are like countries are not yet sure about the program. So we want to make sure that we do everything to make the first one is fully successful. So those who are not sure about the program, they can go on board. So we have these 200 plus, but they are from like not from all the countries, maybe 70 or 60% of the countries that we were targeting. So I don't want to take more time. I wish the program all the best, and I can confirm the strong commitment of the Arab board in terms of the quality, in terms of the surveillance, in terms of the assessment, and in terms of the supports of countries in different places to be able to join. We know that we will accept some of the candidates from countries that they sent officially, while they don't yet have training centers. But we have the coming year to establish the centers. So I thank you very much and all the best.
Thank you, Dr. Awad. Thank you very much. Dr. Hala Youssef, a regional section and reproductive health advisor for UNFPA Arab States Regional Office. The floor is yours, Dr. Hala. Please.
Thank you, Dr. Hassan. Dear Dr. Ahmed Al-Mandari, the Regional Director for WHO Eastern Mediterranean Office. Dr. Omar Al-Rawas, Secretary General, Arab Board of Health Specializations. Dear colleagues, distinguished panelists and participants, good morning to everyone, or good afternoon. On behalf of the UNFPA Arab States Office, I'm here to deliver the word for the Regional Director, who is very thankful to be part of this inauguration. I want to go back to the declaration of Alma-Ata in 1978, where there was the first global political commitment to primary health care approach that centralizes the well-being of populations at the core of health. Since then, this approach was observed as the most effective, equitable, and efficient one to achieve proper health care. And it was the cornerstone for sustainable health systems for universal health coverage and health-related sustainable development goals. The reduction in maternal mortality, neonatal and child mortalities drove the way to include all family members. And hence we're speaking about a comprehensive family medicine program aiming at health for all. We have challenges in the Arab region that continue to risk efficient health systems and universal health coverage. And on top resides the limited number of family physicians, as Dr. Mandari and Dr. Omar has pointed. So we're working on those challenges together. And with the additional challenges that we have met, including humanitarian settings, natural disasters, expecting the climate change that will happen or happening already, this will result in more challenges. And looking at COVID and what have COVID demonstrated, the vulnerability caused by weaker local health systems, we need to work together on this family medicine program And the diploma here will help us include the key elements needed to address health issues and improve health services to women, girls, young people, and older age groups, including community engagement and education, with a focus on the availability of high quality health services. We're looking forward to this implementation of this diploma, and UNFPA is valuing very much the collaboration with WHO, Eastern Mediterranean Regional Office, the Arab Board of Health Specialization, and other partners working on this 2 years regional professional diploma. And it timely comes to our region, responding to the different requirements to increase the number of equipped, capable family physicians, and hence largely contributes to gaps that hinder achieving universal health coverage. UNFPA acknowledges the joint efforts very much to develop the diploma and to the implementation process as well. And having the diploma addressing specific modules for women's health, sexual reproductive health, adolescents, older groups is very important for UNFPA. And UNFPA sees this opportunity to thank all the efforts on this quality diploma and inclusiveness, and will continue to support its propagation and teaching to physicians from our region. Thank you so much.
Thanks a lot, Dr. Hala. Ms. Rachel Meaning, UNHCR MENA Bureau Strategic Partnership Advisor, the floor is yours, Ms. Rachel.
Thank you very much, Dr. Hassan. I'm very pleased to be here today with you to give these remarks on behalf of the UNHCR Regional Bureau for the MENA region, and specifically on behalf of our director, Ayman Garaibe, who is also very appreciative to be involved in this initiative. UNHCR supports this excellent initiative to promote family medicine in the region. The family practice model of care is the bedrock for responding to the complex health needs of highly vulnerable refugee and displaced populations, many of whom live in unstable and challenging contexts. The vast majority of refugees today are hosted in low and middle income countries where the infrastructure, including schools and shelters, health centers, water, sanitation, and hygiene, is already overstretched and poorly equipped to support large numbers of new arrivals. And in this context, it's worth noting that the WHO Eastern Mediterranean region is home to some 50% of all refugees worldwide. The effective provision of comprehensive primary health care, both preventive and curative, is essential for supporting displaced populations, either through fixed health centers, as well as mobile health clinics or home visits that are aimed at serving geographically scattered rights holders who face a variety of healthcare needs, including reproductive, maternal, neonatal, and child health, a high incidence of non-communicable diseases, a large burden of psychiatric and mental health issues, as well as conflict-related injuries and rehabilitation. Family medicine-based care will help improve and modernize primary healthcare services into a comprehensive, efficient, people-centered primary care system that promotes universal access to healthcare and addresses the evolving healthcare needs of refugees and displaced populations now and in the future to ensure that no one is left behind. It would also add value if refugee physicians in their countries of asylum could benefit as students of this diploma in the future, enabling them to contribute as professionals, both to their own communities and their host communities. Ensuring the inclusion of refugees in all aspects of public health, including family medicine, will contribute towards the SDGs and help make universal health coverage a reality for everyone, citizens and refugees alike. And I'd like to finish by thanking everyone involved in this initiative and wish all the very best to the candidates who will be studying in this diploma. Thank you.
Thanks a lot, Ms. Rochelle. Dr. Danielle Negmira, Senior Immunization Specialist, UNICEF MENA Regional Office. The floor is yours, sir.
Thank you very much, and we want to take this opportunity to thank WHO for inviting UNICEF to be part of this important event. And first of all, Dr. Mandari, apologies from our senior management, our regional director, because they had she was traveling, and also Bertrand had another double engagement, so they want to send the apologies, but we are all together. We want to thank WHO for these efforts. We have been working together in the Regional Health Alliance, and I think that really an opportunity which shows how we can achieve a lot by working together as partners, especially on the areas which we know that by working together, looking at the common problem which is faced by our countries, we can be able to achieve a lot. I think this cause is really timely, given the fact that we are all aiming at achieving the Sustainable Development Goals. And we will be able to achieve Sustainable Development Goal by having a very strong and well-skilled human resource in the region. Our region is unique because of the complex countries we have, and the mix of different countries in the region, which may require different approaches in when it comes to programming. And in the Astana Declaration, which is almost 5 years old, PHC was at the heart of efforts on achieving the universal health coverage, and then also achieving the health-related sustainable development goals. And if you look at some of the countries, we have countries in the region, when you look at the health-related sustainable development goals, some countries seem to have already achieved the SDG targets, but at the same time, we have other countries which are still lagging behind, and it will require a lot of acceleration to be able to achieve the result. And to do that, we believe that this diploma course will help to increase the workforce, which is well equipped and with adequate capacity to be able to address the existing challenges in the region, especially related to maternal, newborn, and child health, and then reducing the mobility and mortality, which can easily be prevented by having a well-skilled workforce in the region. And UNICEF is committed to the whole concept of primary healthcare oriented modes of care, and strengthening primary healthcare through a family practice-based model is an essential intervention in achieving universal health coverage in the region. And we believe that this will be one of the big strategies where we can be able to achieve the common goals. Presently, according to the numbers which we have seen, like looking at the ratio between the ratio of family physician per 1,000 population, I think the numbers are still very low. And then looking at the current number of annual number which are added in the region, it's still, the numbers are still very low. So we believe that this course actually will help us to accelerate. And one of the areas which we will be advocating for, maybe how do we, I think from the Dr. Omar Al-Raus, you mentioned about the challenge we have. Some of the countries have not been able to come forward because maybe there is no institutions which will be able to team up with to run the diploma. But it will be really important to look at how we can fast track and reach out to most of the countries which are most in need of such course if they want to move forward with addressing the existing challenges. So it will be good to look at how we can all work together to have country-specific tailored, because maybe amending the course to suit the country context, given the situation on the ground, like the numbers needed and the available skilled workforce, on how this can be amended to suit the country context. In UNICEF, we have been advocating for ensuring that we accelerate the primary healthcare goals. And one of the areas which was important is to look at how we can ensure and scale up the existing intervention, and then also the broadening the package of the primary healthcare services. There are a lot of other innovations which are really important for us to scale up the interventions. And we believe that the experience gained from this initial cohort can help to inform on how the coming causes can be amended to suit the country context. And as UNICEF, we'll be happy to provide country-specific context and sharing experience and work together to look at how we can increase the number of personnel who can benefit from this cause, maybe including having a specific country-specific causes which can suit the country needs. But all in all, we really appreciate for WHO, for all other partners for working together, and we are looking forward to continue working together to achieve the common goal. Thank you very much, and we remain committed as UNICEF to work closely with you. Thanks a lot.
Thank you very much, Dr. Daniel. Last but not least, Dr. Taghlit Farahat, President for WONCA for the Eastern Mediterranean region. The floor is yours, Dr. Farahat. Over to you.
Thank you, Dr. Hassan. Assalamu alaikum jami'an. In the name of Allah, the most beneficent, the most merciful, on behalf of me and my colleagues in WONCA world in general, and the WONCA Eastern Mediterranean region particularly, I hardly find the words to express our sincere gratitude to Dr. Ahmed Al-Mandari, Regional Director of WHO Inauguration, and all his team for their continuous help, encouragement, and sincere effort leading all collaborators throughout this work. I extend our deepest gratitude to Dr. Omar Rawas, Secretary General, Arab Board of Specialization, for acknowledging and recognizing this diploma. Similarly, appreciation goes to the efforts of past and current president of WONCA World and WONCA Eastern Mediterranean region for their advocacy to family medicine. With their support and encouragement, the family medicine specialty has been more appreciated and supported by the policy makers and regional stakeholders. All the praises and the thanks to Allah for giving us the strength and the ability to complete this diploma, which was a dream for all of us, to fulfill the gap in family physician and to maintain efficient capacity building for family physician in our region. As a family physician and the gatekeeper for the health services, I acknowledge this diploma as a victory to WONCA, as it will secure an adequate number of family physicians to allow us to achieve WONCA mission to improve the quality of life of the people of the world through defining and promoting its values, including respect for universal human defining and including respect for universal human rights and including general equity, and by fostering high standards of care in family medicine, which will achieve universal health coverage and subsequently achieve sustainable developmental goals number 3, health for all. Thank you very much and congratulations and best wishes for all the trainees.
Thanks a lot, Dr. Farahat, and thank you very much for the panel members for the excellent opening remarks. Just to highlight the take-home messages from the 6 speakers, WHO, strengthening primary health care through the family practice-based model of care is essential for achieving universal health coverage. Arab Board of Health Specialization is committed to collaborate with WHO to promote the diploma and ensure its sustainability. UNFPA, the collaboration with primary health care partners in the professional diploma comes timely to our region. UNHCR, family practice model of care is bedrock for responding to the complex health needs of the highly vulnerable refugees. UNICEF, family physician is essential intervention, complements the community health system component for primary health care. WONCA, we acknowledge this diploma as a victory to WONCA for achieving sustainable development goal and health for all. Before we move to the next part of our event, I would like to share with you a short infographic about the Regional Professional Diploma in Family Medicine. Ahmed, the infographic, please.
Enhancing family medicine is a key part of WHO's strategy to strengthen primary health care and achieve universal health coverage. So as part of the Global Action Plan for Health and Well-being for All and our regional vision, we are working with the Arab Board of Health Specializations, UNICEF, the United Nations Population Fund, UNAIDS, the United Nations Refugee Agency, and the World Organization of Family Doctors on a 2-year diploma in family medicine.
The Arab Board has graduated so far over 20,000 medical and health specialists. The Arab Board has recently partnered with the WHO Regional Office for the Eastern Mediterranean and other partners in establishing a regional professional diploma in family medicine with the intention of scaling up production of physicians who are qualified in family medicine to support strengthening of health systems and promotion of health care, in particular universal health coverage.
There is a large gap between the number of family doctors we need in the Middle East and North Africa, Eastern Mediterranean region, and the number we actually have.
Through effective engagement, that gap can be filled, helping to ensure access, equity, quality, and efficiency in primary healthcare services.
Family physicians provide comprehensive primary health care. That includes prevention, cure, and rehabilitation. This wonderful regional initiative can help make WONCA's motto a reality. Always there to care.
Let us continue to work together to support member states in our shared efforts to achieve health for all, by all.
Health for all, by all.
Health for all, by all.
Health for all and by all.
Thanks, Radha. Thank you very much. We have the diploma implementation overview from our colleagues from the Arab Board of Health Specialization, Dr. Sheikh Badr, Chairperson of Strategy Office, and Dr. Mona Osman, Head of the Training Committee. Over to you, colleagues.
Thank you so much, Dr. Hassan. And we are glad to witness this important inauguration. In fact, I will be providing a very quick overview, and then Dr. Mona will proceed with presenting on the implementation arrangements. In fact, there are 3 key milestones in implementation of this diploma. The first one is the joint committee between the Arab Board of Health Specializations and WHO that has been supported by His Excellency's Regional Director and His Excellency's Secretary General. And that committee has been instrumental in working over the past months in weekly meetings to oversee the implementation process of this diploma with participation from WONCA colleagues. So that committee has been key in the process. The second milestone is the work within the Arab board itself. In fact, this diploma has been taken very seriously within the Arab board, and it's approved by the executive office and the Supreme Council of the Arab board, and there has been senior discussions. Also, the arrangements within the secretariat has been going on. And again, His Excellency, the Secretary General, has formed a special committee as part of the Family Medicine Council to oversee this diploma program. The third dimension is the joint work between WHO and the Arab Board in reaching out to countries and to candidates, potential candidates for advocacy of the diploma program, and building collaborations with country institutions to enhance the process of recruiting the candidates. And that's why we ended up in this term with the current number of applicants for this diploma. One of the challenges that we faced is mobilizing different countries to take part in this diploma. And we are very much aware now of this challenge. And in fact, we are planning to reach out more effectively to institutions within countries to support scaling up the numbers in the next round of application for this diploma. My colleague, Dr. Mona Osman, will be providing more details around the implementation of the diploma program. Thank you.
Thank you, Dr. Badr. So good morning, everyone. It is a great pleasure really to be today here. Okay, I'm just sharing the presentation. So it's can you see it? Is it seen? Yes. Okay. So
yes,
it's
Dr. Mona, we can see it. Just
okay.
Please put it on the presentation mode, please. Yeah. Thanks.
Now it's yes. Oh. So good morning, everyone, and really to be here today. You know, in the inauguration of the regional professional diploma in medicine, which is a collaboration, as it was mentioned, between different entities. We have the Arab Board of Health Specialization, WHO, EMRO, WUNCA, UNICEF, UNFPA, UNHCR, and UNAIDS. So this diploma is really a 2-year structured training that will be offered in a blended format. It will be delivered and accredited by the Arab Board of Health Specialization, and it aims at equipping its graduates with the knowledge, the skills, and attitudes that are needed to provide comprehensive, continuous healthcare to individuals and families, hence improve the quality of healthcare at primary level, and at the same time, paving the way towards universal health coverage. So who are our targets? They are general physicians who do not have any additional specialization after medical school, but who have at least 5 years of experience after getting their medical degree, and at least 3 years of experience in primary healthcare setting. And they should still have a valid license to practice and a current clinical practice. This program offers really flexibility in learning for practicing doctors who can work and learn at the same time, and it opened the ways also for future career paths in family medicine. So description of the program. So as I mentioned, it is a 2-year program. The first year will be fully online using a learning management system, which is Moodle. It includes 4 terms composed of 8 blocks, and each block is of 6 weeks duration. So what do we have in each block? We have 4 weeks of self-study where the learners will be studying themselves, but of course it will be under the supervision of tutors. So we will have 3 online teaching sessions with tutors in each block, and this will include also discussion of clinical case scenarios and clinical skills. We will have a 1 masterclass online webinar. We have discussion forums, formative assessments, and an online summative assessment at the end of each block. Learners will have to complete their portfolio and logbooks, and we will have a final year written examination. Year 2, it will be a blended, so we will have an online component and we'll have a face-to-face training, It is composed also of 4 terms, 8 blocks, and the block is 6 weeks again. And in these blocks, in addition to the self-study and in addition to the online teaching sessions with the tutors, we will have 3 sessions of practical clinical training in a training center that is accredited by the Arab Board of Health Specialization. And we will have also the 1 masterclass line webinar, the formative assessments, and the summative assessment. To that, there will be a mid-year project, which can be a research or quality project, and a final written exam and OSCE exam. So at the end of this, if the learner will pass these exams, he or she will be given the diploma in family medicine. So what does the curriculum cover? The curriculum, in fact, is mapped to the competencies of family medicine, general practitioner, as covered by or as defined by WUNCA, ACGME, and the College of Family Physicians of Canada. And we will be having 8 modules in this diploma, covering the different perspectives that a family physician should know. So we will have an introduction to family medicine concepts and practice, a module on non-communicable diseases, mental health, adult health, women's health, and reproductive health, of course, child and adolescent health, elderly health, and also family medicine in special contexts like in emergencies, pandemics, etc. Each module is divided or will be delivered over in different blocks. So for example, module 1, which is the family medicine concept and practice, will be covered in 2 blocks, which means 12 weeks. And one of the blocks, the part block 1 will be delivered first in the beginning of the first term. And for example, block 5 will be delivered at the level of, at the beginning of this would be, this is how the modules will be delivered in different blocks all through the 2 years. This will allow the learners to really expose to the different problems or conditions that family medicine should see at the level of the primary care, and they will be continuously exposed to these topics all through the 2 years. This is just from the Moodle. So as you can see, the Moodle, we will have, for example, this is the first block, Introduction to Family Medicine, where we will have the different topics. It will allow also for the learner to know which sections they completed, if this is colored or not. It will allow also for the tutors to track the work of the learners, and also it is delivered in an interactive way. And the students, they have to complete all the topics in each block, including all the interactive lessons, the MCQs that are present there, to make sure that they really completed all the material that they have to study. So this is based really on adult learning. So they will be really actively pursuing also the learning themselves. So as Dr. Badr mentioned, a committee was established at the level of the Arab Board to oversee the implementation of the diploma. And this committee is collaborating and coordinating with the task force, the joint task force between WHO and the Arab Board. And the role of this committee is to oversee the development of the curriculum, the training content, the assessment tools, the selection of candidates, tutors, the delivery of the training, the follow-up of the learners, the coordination with the tutors, coordination with the training centers for academic matters, the periodic update of the training materials whenever it's needed, and also for monitoring and evaluation of the training program. How did we select our candidates? So as you all know, we received first an online application. We received first the applications through online through the websites of the Arab Board and the websites of the WHO. We received around 1,962 applications from more than 40 countries. We limited our review and filtering to the 19 countries that are included or that are, where Arab Board and WHO EMRO works. And we ended up with 900 applicants. We sent the list of these 900 applicants to their respective countries where they are practicing, in fact, for validation, approval, and suggestions of new candidates if there is a need or as required. And we received the list of the first candidates, our first cohort, which is composed of 205 candidates. We have them from 10 countries in addition to UNRWA. So we have candidates from Egypt, we have from Libya, from Palestine, from Sudan, from United Arab Emirates, from Qatar, Morocco, Iraq, Jordan, and Lebanon. This is our first cohort, in fact. And regarding the tutors, also we received the expression of interest to join as tutors from more than 65 experts in family medicine from 11 countries. In fact, the committee put some selection criteria for the online tutors and the face-to-face trainers. So for example, prerequisite criteria, they should be graduates of a structured training program in family medicine. They should have a current clinical practice, and they should have a teaching experience of at least 5 years for the online tutors and 3 years for the face-to-face trainers. And additional criteria include board certification, postgraduate degree in medical education, scholarly achievements, and experience in online teaching. How the learners will be distributed by tutors and trainers. For online tutors, we will have one tutor overseeing 20 to 25 learners and a maximum of 25 learners. And we will have these learners from different countries. This mainly to encourage, changing experience between the different, participants. And for the face-to-face trainer, we will have one trainer with maximum of 5 learners from the same country, of course. And training of tutors is essential. So as Dr. Badr mentioned, in fact, we faced some challenges and some hiccups in a way in the recruitment, especially of the and the registration of the candidates. This is mainly because this is a non-traditional training program. It's blended with online tutors and online components. There is, okay, somebody maybe has to close the mic. The regional perspective, the regional perspective of this diploma, which we have different contexts, different administrative processes in the countries, also regarding the availability and the distribution of accredited training centers in each country, because maybe we have these centers in 1 or 2 cities, but we have applicants from all over the country, and also the candidates recruitment processes, which really were different between one country and the other. But finally, we're all set to go. So we have our 205 learners, we will have 10 tutors, we have our training content on Moodle, and we have our assessment tools. And we're happy to really congratulate the first, or wish the first cohort of candidates for the regional professional diploma in family medicine. And we hope that we will reconvene in 2 years in October 2024. Thank you very much and best of luck.
Thanks a lot, Dr. Mona and Dr. Badr. The next is a brief scientific session on the diploma. Yes. Okay. And we'll start with Dr. Anna Sterder, President for WONCA, and the second presentation is for Dr. Ghassan Hamada, Professor of the Family Medicine from the Central Michigan University. Over to you, Dr. Anna, first.
Good afternoon, everyone. Dignitaries, colleagues, partners in care, and not least candidates, dear candidates. Thank you for this invitation to speak on the important event. The Family Medicine Diploma is a huge achievement in so many ways. It raises the profile of the specialty of family medicine in the East Mediterranean region. It will also bridge the existing gaps in training of primary care physicians in your countries. And not least, it's an excellent example of collaboration between WHO and partner organization, WONCA being one of them. And no surprise, as EMRO, to my experience, leads the way in this regard. So my heartiest congratulations go out to all of you. Before I share my reflections on what it means to be a family doctor, I'll give you a few facts about WONCA, the World Organization of Family Doctors. And now I'll just see if I can make my slide Can technician help me because I'm not able to operate my slide here? Anything we can do to help out?
Try unsharing and then sharing back again.
Okay. So I shall not share. You shall share, and then will you operate the slide?
Yes, we can see it now. It's gone.
Okay, you can see it, but I cannot operate the slide. So can you operate the slide for me?
Okay, hold on for a second, please.
Mm-hmm.
Do we have the slides?
Yes, give us just a couple of seconds, please. Yes, we're going to display it from our side.
So, okay. I can speak while we're waiting.
Yes, sure. Yes.
So what I'll show you now in a few seconds. Let me have the next slide, please.
Okay. Can you move to the second one?
There we are. This is the WONCA map. WONCA is the global network of family doctors with 130 member organizations in 110 countries globally. And we have member organizations in all the 7 regions. We represent more than 500,000 family doctors engaged in education, research, professional development, and not least in advocacy. Next slide, please. Development of the professional development content we deliver takes place in the many working parties and special interest groups, 28 altogether. Some of the groups work on general topics, but also in specific clinical fields, as you will see. I have highlighted that maybe the most relevant for our topic today, the Working Party on Education. Next slide, please. Does it make sense to speak about family medicine as one globally, given the vast diversity in political systems as well as in health systems? The answer is yes, and I will now explain using photos and experience from my own context in Oslo, Norway. I know that the next speaker will focus more on the scientific rationale for family medicine as a bedrock of health systems. I will therefore take you to my practice and make an attempt to explain how it might look like on the ground. Next slide, please. Here's my team. We are 4 doctors of different ages and experience and a staff of nurses, practice assistants. I've worked in this practice, and you will understand, not with exactly the same persons, for more than 30 years. Together, this team delivers personal, continuous, comprehensive care in the community. And that's the gist and the short answer to what family doctors share worldwide. The context can vary, but the values are the same. Next slide. Let's start with personal. One of our most significant forefathers in family medicine, the late Canadian professor Ian McWhinney, put it this way: family medicine is the only specialty which defines itself in terms of relationships, especially the patient-doctor relationship. And just to reassure you, photos are used with my patient's consent, and the stories I'm telling you do not correspond to the individuals on the photos. What I can tell you, however, is that I have followed all these 3 patients over decades, one of them since before he was born. The personal relationship is the basis for mutual trust. As a patient, you are more likely to follow someone's advice if you trust them. And trust makes you share information which you wouldn't volunteer to a stranger. Information which can be crucial for diagnosing and tailoring treatment to that individual. Medical conditions do affect each person differently. These differences reflect who we are as individuals, physically and emotionally. We are the result of millions of years of genes and biology, decades of psychological experience, a product of the culture we grew up with and the times we live in. And all of this comes to the forefront when we are sick. Next, please. Over to comprehensiveness. This on the screen, you see another reflection of another great thinker of our specialty, United Kingdom colleague, Sir Denis Pereira Gray. He says, family medicine is the easiest specialty to do badly, the hardest to do well. How come? Well, imagine combining medical knowledge, psychological insights, experience on community level, and health system thinking when helping the individual in front of you is challenging and rewarding. Family medicine is person-centered. That means there is no, this doesn't belong with me. Everything the patient brings to the doctor's attention is potentially significant, as each individual carries a genuine own complexity of medical history, family history, and life experience. Next slide. Here is some of the areas the family doctor works in. We could add several. Elderly people, emergency preparedness, not least an actuality over the last 3 years. Speaking medicine itself, everything belongs to our field. And the challenge is to combine, manage with evidence-based guidelines in narrow specialty fields. They are often contradicting each other, and be your patient's guardian and make sure she gets the best medical service possible given the medical complexity of her own person. People don't have one reason to see the doctor. They often have several, and at least over time, the issues are several. We don't remain the same over years, any of us. I can give you one example. Sleeping disorders, for example, calls for different approaches dependent on age, history, and comorbidity. Next slide. The opposite of comprehensive, to put it in perspective, is fragmented. In our times, fragmentation is a general trend in society and in medicine in particular. This is Arturo Casadeville, professor of microbiology and immunology and infectious diseases. He thinks that fragmentation is harmful. He believes that by making doctors more specialized, everyone is digging deeper into their own specialism and really standing up to look over into the next trench. The solution to the problem might be right next door, but they're at risk of missing it because they are so focused on their own field. Family medicine is the answer, not because of omnipotence, but because we have another approach. Our point of departure is the complaints and symptoms of the patient and the individual composition of them. Next slide. The jewel in the crown of family medicine is continuity. Data keeps coming in, not least after more than 2 years of the ongoing pandemic. What is the pivotal factor which made some health systems succeed when rising to the challenge? Primary care-based systems with primary care professionals providing personal care over time is the answer, was the answer. I know, again, that the next speaker will elaborate on this from a scientific point of view. My contribution is therefore a testimony that I have had the power of personal care over time reconfirmed time and again, more than 3 decades in clinical practice. A family doctor holds multiple roles in the relationship with the patient over time. She is an interpreter of the patient's symptoms and illness. Her duty, the doctor's duty, is to prioritize patients with conditions in need of treatment and spare patients from wrongfully being treated as sick. The family doctor is also a guide and a teacher, helping patients to understand their own health situation and how best to manage or alleviate it, in addition to help navigate the healthcare system. And not least, family doctors are witnesses and partners. We follow patients and their relatives, their carers and partners through illness and suffering. Next slide. For primary care to be effective and efficient, it needs to address the actual needs. People live in the communities, and epidemiology reflects the pattern of social determinants in that specific population. The family doctor works in the community and has ear to the ground and makes first-hand observations of local trends and developments. Based on that knowledge, we can tailor care to the population as well as to the individual. Next slide. Health and social care address two aspects of caring for the same needs. Yet they have developed into separate and independent services in many countries and systems, as the pandemic exposed so very clearly. This is another example of how fragmentation drives care systems in, I would say, a wrong direction. I can give you 3 examples. It's not enough to keep patching up the wounds of a battered woman and then sending her home with no referral to safe shelter. It's not enough to offer an unemployed person with diabetes the very best dietary advice and regular monitoring of his blood glucose levels if we don't address that he has no money to buy food. The health of women and newborns is always in jeopardy during a crisis, like we've seen during the pandemic. They often prioritize others' needs before their own. When social services for the sick and elderly shut down during the pandemic, many mothers of infants stepped in to fill the gap, posing health risks to mother and child. Family doctors are positioned in the community and can help bridging that gap between health and social care if we are aware of it. Next slide. A quote by the already mentioned Sir Denise Pereira Gray will be my second final remark. It is the conclusion of a BMJ paper he published with colleagues in April 2019. It compared a number of high-quality scientific articles on what we call continuity of care. Close to 82% confirmed that the quality of ongoing doctor-patient relationships affects mortality rates. The better the individual's relationship with their long-term doctor, the lower their mortality rate from all causes of death. The authors say, for 200 years, medical advances have been mainly technical and impersonal, which has reduced attention to the human side of medicine. This systematic review reveals that despite numerous technical advances, continuity of care is an important feature of medical practice and potentially a matter of life and death. Next slide, please. Dear colleagues of all professions, when delivering community-based care, we family doctors are members of primary care teams. Now, more than ever, what the world needs is high-quality primary care, a close-to-home healthcare hub that functions in seamless collaboration with social care and public health services, as well as with hospitals. That requires a strong multi-professional team with a qualified family doctor on board. That is the headline for WONCA's advocacy as we speak. And I will remind you, precisely because we keep up with the evolution of our fundamental core values and make them the basis for our teamwork, they endure. WONCA is proud of the EMRO Family Medicine Diploma. And so let me, on behalf of the global community of family doctors, congratulate you, and I thank you for your attention.
Thanks a lot, Dr. Anna. Thank you very much, really. We're always proud of working with WONCA. Dr. Ghassan, over to you, sir.
Okay, 1 second. Let me see what I have here, and here we go. Okay, good morning. I will actually pick up from where Dr. Stavdal said, strong multi-professional team with a qualified family medicine on board. And I think this is the key of what I will present to you, basically. When, listening to everyone, one would think, oh my God, I'm going to be a family doctor, so I'm going to be personal, comprehensive. I will know about everything. I will know about treating well children, refugees. I will know about ultrasound. I will know about minor procedures. I will know about pneumonia, diabetes. No, you will be qualified to lead and manage and be part of a strong multi-professional team. This is in brief what I will present to you, and then with some history for our endeavor. So we're going to go over some of the rationale and evidence, challenges, and how we started. As usual, when we think of any healthcare service, any hospital, any clinic, any government, any ministry, they think of what we call the triple aim: better quality care, universal care, reaching everyone at a reasonable cost. WHO has shown this with this diagram here, this cube, as you can see, where there are this cube which represents resources, number of doctors, number of nurses, number of clinics, number of hospitals. So resources, and there are competing powers, competing vectors pushing and stretching this cube. So if you imagine we have only this cube, and then I need to give more to cover more population, and this is a limited resource, then it will shrink. Either quality will be less, or services will be less, or costs will be more. One of those dimensions will switch. And that is the challenge that every government, every university, every hospital faces. If I have limited resources, how can I reach my triple aim? And then the perception is that family doctors can make sure their resources are spent on the right patient, right time, right specialist. Strong multi-professional team with a qualified doctor who can ensure resources are spent on the right patient, right time, and right specialist. So how is that done? That is done multi-professional team, team-based, patient-centered, primary physician-led. So I will elaborate on these items as we go on. So when you go to you finish this diploma and you go to start working, you're part of a team. You are part of a team that you need to support and strengthen and make sure they are efficient and make sure you are using them. An example was given by the previous speaker on person with diabetes. How would the endocrinologist management of a diabetes differ from that of a family physician? The team-centered, the social worker going to the home versus in the endocrine clinic, we have a nutritionist maybe, or a nurse who would teach a diabetes educator. So it's a wider, different team. So the path to get universal health coverage and to reach this triple aim is not new. It has been known for a long time and championed particularly by a pediatrician, Dr. Starfield, who said this triple aim is best championed by having a primary care team, because the team can function and have community orientation and can function more efficiently than individual fragmented individual specialty physician and leaving care to the patient himself. She collected a lot of data, she collected a lot of research, and one of the famous or one of the most commonly shown slides are these two slides, where it shows where, you know, primary countries with more primary care cost less. This is, of course, all this is from 2012. And if you have the more primary care physicians per 10,000 population, the longer people are living. So these are interesting. Of course, you don't take these two variables by themselves. There are many other variables that affect these life expectancy and so on. But in general, there must be something important to having more primary care provider, more teams, and to be able to deliver this triple aim. So how do we deliver this triple aim? As I said, the team, and now we talk a lot about patient-centered, team-based approach. You're going to hear this, especially in the introduction part of your training. What does it mean, patient-centered? Patient-centered or community-oriented is like the specialty of family medicine creation itself, or like this diploma creation itself. It was not created because of a scientific discovery or a special interest in an organ system or how things operate. It was, the diploma was created, the specialty was created because there was a need in the community, in the society, for a primary physician, for a special kind of physician. So this is when we say patient-centered, and the approach is patient-centered. So the same way, the way you design your team, the way you design your healthcare approach in a clinic in a mountain versus in a clinic in a city, rural versus city, you design your organization, the delivery of care in a different way because you're thinking of your patient, and you involve all the members of the team, a wellness coach, behavioral health, social worker. Depends on what the needs of the community are. So if you're working in a migrant, in a refugee environment, is a different thing from if you're working in an industrialized versus an agrarian society. And this is the flexibility of family medicine, and really what makes it so different and so challenging. The team-based, again, we're talking about the team-based, and sometimes this is important for the newcomers into the specialty. You think sometimes you have to do it all, and I'm repeating myself here. No, you have people assisting you. You may have a case manager helping you with medication refill, with monitoring the markers of chronic disease, calling the patient, giving education about the test result, and so on. So it's a team working together. It's not you doing all these things by yourself. And as I mentioned, this is not new. Barbara Starfield talked about it in the 2012, but the whole birth of the issue of primary care physician or primary physician or family physician dates back to even in the UK and before and after that in the US in the 60s. In the 60s, a graduate medical education made a report. They were commissioned by the American Medical Association. This is called the Millis Report. For the US, this is the birth of family medicine. And they observed that less and less people are going into the general practice. More are going to specialties. So they think of fragmentation of care. And they said, okay, so what shall we do? Let's create a 2 or 3 year graduate program as a means of improving and perpetuating the GP. Yes, no, how should we do it? What would they do? They will not focus on individual organs. They will focus on the whole person. At that time, they have man, woman, man was for everything, who lives in a complex social setting. We're talking about 1960s. So this report, 1960s, this is where you can find it and read more about it. And they debated about the name. They spent, like, they have discussions and discussions. Should we call it a GP? Should we call him a family doctor? Should we call a primary care doctor? At that time, the report said, let's call them the primary physician, which I am trying to revive again and say, the family doctor is the primary physician, the main go-to person for delivering care. So in brief, if you have to remember anything from this discussion, family medicine is health system dependent. It's community responsive. It is designed and modified and changed based on community and community needs, community wealth, and so on. It is essentially a general practitioner with all the skills, about all the spectrum from the whole family, from birth to death, plus an extra training, state of mind, and the health system to be able to deliver to the right patients, right time, right specialist. So this is in what it means, or what is it about family medicine. So we went to the Eastern Mediterranean region and thought, like, what is the issue here? How can we achieve the triple aim: better quality care, reasonable cost, and reach universal health coverage? And we had many meetings led by the EMRO WHO team, Dr. Salah in particular, Dr. Mandari making it happen, and then joining forces with the Arab board, discussion with the Arab board, what should we do with WONCA, what should we do, and the various stakeholders that you see today, and discussions like, how can we scale up family practice? Meeting after meeting, discussions after discussions, come up with ideas, visions, and so on. And we kept saying, we need to reach 3 family physicians per 10,000 as one element of the whole change in the healthcare, achieving the triple aim in the healthcare. Today, we're creating the leaders or the coordinators or the patient advocates, the primary physicians. Tomorrow, we'll go into projects or building the rest of the team in the nursing, in the education, in the social work, and so on. So the strategies for physicians, we discussed it at many numerous meetings, was one, increased number of graduates by increasing residencies and developing faculty and so on. And this is continuous, ongoing. But then the fastest way to reach the 3 per 10,000 was creating those bridging, transitioning programs. So each country, again, being responsive and sensitive to the needs of each country, building their own system. And then we elected to have this diploma where all the stakeholders came in, and you have the content that was shown by Dr. Muna Osman. This is built on the initial testing. As you say, we tested this in Lebanon and with UNRWA on Palestinian physicians and on physicians in Lebanon with a general practitioner. And we said, okay, we'll give you this transitional period program, and gradually we'll build these teams. In fact, we believe many of the initial programs can help us, initial trainees in the initial programs can help us be tutors in later programs. The course journey was shown in detail by Dr. Osman. I will go over it in a quick way. There is always a quick orientation on how to use the blended tools, the blended computer programs, and so on. And then there are learning blocks. Learning blocks are a mix of online training, online chatting, giving assignment, on-the-job training. So remember, this is a major difference between a residency program where you reside, you stay in a health center or in a hospital, and this program where it is on-the-job live training. And then there are reviews like what we're doing now, for example, lecturing and discussion, and finally, final exams and OSCEs and evaluations. This has been worked on a lot. A lot of help has been provided by the WHO EMRO educational team when they challenged us with our initial proposals about, like, how are you measuring? How did you decide on the content? And so on. This was really a blessing. And then we had all the other stakeholders come in, each mentioning an important priority in their area, in their specialty, or in the countries where this is planned to be. So this is a truly a joint effort of all these all these teams, and it's really fantastic to see it come to fruition. And I'd like to thank you all, the 180 persons, residents, as we call them, who have accepted to do this program and take the challenge. Again, patient-centered, team-based, primary physician-led. And this is not only in the diploma, it is also now the new family medicine residency content is being modified to become more and more oriented in this direction. Thank you very much.
Thanks a lot, colleague, for the actually excellent presentation. I can see lots of questions on Slido, and Dr. Saeed Sulaiman, the family medicine consultant in the WHO Eastern Mediterranean Regional Office, will moderate the questions and answer session. Over to you, Dr. Saeed, please.
Thank you, Dr. Hassan. Thank you. I have
We lost you, doctor.
You have to put the mic.
Yes, now, yes, go on. Oh, go on.
No need to.
You don't need it.
Okay.
Yes.
Can you hear me now, Dr. Hassan, please?
Yes.
Okay. So the first cluster of questions or theme of questions are actually students, even we are receiving these questions before this meeting. They are asking if they lost the chance of joining this cohort. And they are asking our colleagues from the Arab board, when is the next cohort? So I may direct this question to Dr. Omar Rawat, if he is still with us, to answer this question.
Sorry, I didn't hear the question.
When is the next cohort, Dr. Omar? Are they have to wait for another full year to be in the next cohort? Some of the students who are not registered with us in this cohort are asking about the date of the next intake of the diploma.
Yeah. The intakes in Arab board for all programs is 1st of October every year. 1st of October every year. We have exceptional under specific requirement, like because of delay of processing or anything, that we kept it in April, but it is not a full opening of admission. Like it comes from the countries and with specific explanations and also a study by the council, and if accepted, it will be a small group. It's not like we don't have two tracks every year. We have only one track, which is October. Every year for all programs. We have 59 programs, plus this program will be 60. So those who missed this year will be next year, if also accepted. In the Arab board programs, all admissions, this time it was a good practice that we announced it directly from the WHO and also from the Arab board, and we get many candidates, so we get an idea about that, like the willingness of the candidate to get. But in reality, for the Arab board, we accept candidates through like a recommendation by their countries, because if the country recommends the people apply to their countries, and then if the country send their names to the Arab board, it means that they are committed to make the program available to them in the way that we structure it. So in terms of, you know, the big countries, and then there's only one center in the capital. So there will be mobilization of the doctors. They need to have support to leave their place of work for a few days every year, every month, and to have some protected time. So it's our policy, and we are, as you know, we are part of the Ministers of Health, and our commitment to the Ministers of Health Council, and we take all candidates through the ministries. And those who 205, they all come through their ministries. And so in the future, we will be looking at people applying through their countries.
Okay, thank you so much, Sir. Thank you. The other set of questions are for students who are in the final list with us, but they are missing some final registration processes at their country local authorities And for those questions, I refer this question to Dr. Sheikh Badr, if he has some message for those students.
Yes, Dr. Saeed, thank you. I think I have already pointed out this, that we are having, as you know, in the steering committee, in the committee, the joint committee, communication with different institutions across countries in order to enhance and facilitate the application process and the selection. And that will continue, actually, because as the Secretary General, Professor Omar, was pointing out, the way programs function under the Arab Board is through collaboration with countries, training centers, health authorities in countries that recommend and approve applications. So it's our duty to continue working with countries, with institutions within countries, to prepare well for scaling up the numbers for the next applications. Thank you.
Thank you so much, sir. Thank you. We have also another repeated questions thanking us for this very informative session, saying we have understood why WHO Arab Board and the mentioned partners are collaborating on this, and what are the next steps for spreading this program and increase the awareness of the people and the doctors about this initiative. And I may refer this question to you, Dr. Hassan.
Sure. Thank you. Thank you very much, Dr. Said. The next, as you can see, so far, that the diploma, it is a kind of a regional approach. That's why we call it the regional professional diploma in family medicine. We need to take this little further step from the regional approach, as it is so far, to a kind of national approach things, in which we are hoping that by December 15, the member states, countries, they are going to sign what we call it the call for actions for the regional professional diploma, in which we are going to go further step and implement it on the national level. And this, I don't want to say a kind of commitment, but definitely it's going to support the member states' implementation later on in the field for the diploma. Thank you, sir.
Thank you, Dr. Hassan. Thank you, sir. This is a rather, Dr. Ghassan, you mentioned this, the future of family doctor and the teamwork. So many doctors here, are asking about their future. I'm not asking technical questions like doctors saying if the diploma is valid from the first day of graduation, if it is valid worldwide on the Arab world. I think these questions all are around what is the future for family doctors in our region. And I think, Dr. Ghassan, you are in a good position to answer this question. Thank you.
Well, the future of family medicine, not only in our region but in the whole planet, is definitely bright. The main reason is the push for universal health coverage, achieving the triple aim for the quality of care and rational expenditure on care. And we need a patient advocate. We need a primary physician who can lead those teams that will deliver care. Take obesity, which is an epidemic now, disastrous epidemic. Take diabetes, take cardiovascular. All of these, controlling these would require teamwork that is with a community sense, with a community orientation, each community being addressed and its particular need, eating habits, exercise habit, weathers addressed, teaching at the school and so on, primary physician led. And this is why I think family medicine will strive and will get more and more, will be more and more required. Maybe the training content will be different. The training content will be different as we go on with technology advancement and with the particular needs that we have, and with the numbers that we need. So it has to go hand in hand with a health system. So patient-centered, team-oriented, and health system guided. Yes.
If you allow me, Dr. Hassan, to just add to.
Yes, sir.
Thank you very much. It is a very important and interesting question, and thank you, Dr. Ghassan, for shedding light on it, and thank you for the presentation. In fact, I just wanted, to add to what has been said about the importance of family medicine, primary care in general, but family medicine in specific. We have still fresh experience with COVID-19, and it has shaken the whole world, and it has shaken all health systems, regardless of their wealth and resources. Equally in well-resourced countries, well-established systems, to fragile and countries suffering from conflicts and instabilities and shortage of resources. Definitely the impact in these type of countries is less compared to the other, short-resourced or fragile countries. But generally speaking, it has shown gaps and weaknesses in the health system structure. And one of the key lessons that we have learned is the weak attention given to primary care in general and family medicine in specific. COVID-19 led into the disruption of maintaining, and giving essential health services to everyone, from children to mothers, to men and women, to elderly, to everyone. And we have seen now the long list of waiting lists of people waiting for basic services, people waiting for their medications to be given to diabetes, hypertension, bronchial asthma, and others. So it led into the disruption of the continuity of services. It also led into the fear of leading to, high turnover of staff, running away from health systems because of the overload, because of the tension. It led into ignoring the mental health, for example, in addition to the physical health, because there was a shortage of competent, skillful health professionals caring for people when it comes into these health needs. To me, one of the top listed lessons is we need to strengthen and pay enough attention to family medicine. Definitely primary care, but family medicine. We need to produce more family physicians, because as has been shown in the presentation by Dr. Anna and Dr. Ghassan, it is continuous, it is comprehensive, it is personal oriented, it is not disease oriented, it is a very systematic, holistic approach. So this is just one thing that I'd like to add about the importance of family medicine. And that's why systems now, they should really learn the lesson and give enough attention to establishing, rebuilding primary care and family medicine, not only in IMRO, but as Dr. Ghassan said, around the globe. I'm sorry if I took this much time. Back to you, Dr. Hassan.
Thanks a lot. No, thank you very much, Dr. Ahmed. Yes, Dr. Awas, over to you, sir.
Thank you, Dr. Hassan, for this quick opportunity for me. First, because I'm supposed to be another Zoom meeting 5 minutes ago, so I will have to leave you. But I want to give a quick message, if possible, for everybody. From our experience in getting through until we get this a number of candidates, I believe we need to work on convincing the countries how important this is. Many of the countries responded that we are not yet sure about this program and we will study it and will respond to you, means in the future. I think maybe with these organizations, if we can make a presentation to the Arab ministers of health in their coming meeting to present this so they can adopt it. Because many of them, they are not supporting candidates in their countries if they are expatriates. So many of the applicants were not able to join because they are working, they are from one Arab country, but working in another Arab country. And so they did not get the support. And I think this is a message that easier for WHO than the Arab board because of your connection with the ministries. Thank you very much. I'm sorry I have to leave before you finalize because I'm already late for another meeting.
Thank you, Dr. Awas. Thank you very much, sir.
We have, I think this is our final question. This is related to the diploma procedures itself. And I think the best person to answer this question is Dr. Mona Osman. The study program, the study schedule and time. And we don't want to repeat these questions regarding is it recognized worldwide or just the Arab world. I think we focus here, Dr. Mona, about for those confirmed registered students with us. what is the next steps for them? You are asking about that.
Okay. Yes. So thank you for the question, Dr. Saeed. As I mentioned, we're already now set to go. So the next steps would be they will complete the registration in the coming 2 weeks, and we will have an orientation session for them on Moodle and to discuss all the details of the training program. So the first step for them now is to complete the registration, all the administrative process of the registration, and we will start hopefully with the orientation session in 2 weeks' time.
Thank you so much, Dr. Mona. Thank you. Back to you, Dr. Hassan.
Thank you very much, Dr. Said. We may need to schedule kind of for like 90 minutes just discussion with the whole colleagues for their questions. Maybe Thursday, which is October 13th, not this coming on, the next one. It will be good for them to respond to their, because still there is a lot of questions in the slide. Anyway, thank you very much really for the panel member. Now we are going to move to the last part of our event for the closing remarks, and we will start with Dr. Rana Haji. Thank you very much, Dr. Rana, being with us. Director of Program Management for Eastern Mediterranean Region Office. The floor is yours.
Great, thank you very much, Omar. I thought you had another speaker. Okay, great. Thank you very much, Hassan. And really, I have maybe very little to add to what was already mentioned, but thank you for the opportunity to be part of this very important launch. This is something we don't often do in WHO. We are not a university. We are not an academic. So it's actually quite unique, and I'm very privileged to be part of this. Of course, I would like to thank all of our colleagues who joined, excellencies, directors, all of the colleagues from the other UN agencies. I'm not going to go one by one, as Hassan wanted me to, but really thank you all very much. And really, most of the thanks go to the really strong team that supported us with WONCA, very closely working with WONCA, very closely working with the Arab Board, very closely working with the team from AUB. I know Ghassan is not AUB anymore, but this was a very strong participation from Mona and Ghassan. They have been with us all through this. And to be honest, when I'm listening to all of you, I mean, it sounds quite daunting job. I mean, what Ghassan mentioned about the triple goals, the better care, quality care, but yet at a reasonable cost, it sounds like an impossible job. Nonetheless, I think, especially in these times now, post-COVID, I fully agree that we need to, I think there's a lot of future for family medicine because it's very much needed. One of our biggest challenges during COVID wasn't just taking care of COVID patients, it was the continuity of essential health services. And I think the importance of primary health care became even more obvious to anyone working in any official level, to ministers of health, to governments. For us at WHO, this week is actually a very busy week. We are preparing for our regional committee next week. And our motto or the slogan is towards a healthier and sustainable tomorrow. We cannot achieve a healthier and sustainable tomorrow without universal health coverage. So this program is really one of our maybe very critical steps to really start addressing the gaps in our countries in terms of being able to deliver better services and for a more universal health coverage, which we all committed to in this region in Salalah. The whole world came to Salalah in 2018 to make the commitment towards universal health coverage. And I see this as a very complete effort to do it. I liked all the presentation really, but one of the slides that Dr. Anna showed about minding the gaps, we do have huge gaps in our region in terms of having better primary healthcare physicians, better prepared, better trained. Awad and I just came back a week ago from Somalia, and actually I was asking him during the the meeting if we have candidates from Somalia. Somalia is one of the countries where one of their biggest problems is really having the right healthcare workforce. They need more PHC, they need more physicians trained in family medicine and others. I think it's really very important for us to see this program being rolled out in the region. I think with what Dr. Omar mentioned at the end before he left, it is, I don't want to put even more burden on our shoulders and on the students who signed up for this. If we can deliver, if this program is successful, then we will be able to have more and more trainees. I mean, so it's really a pilot program, and we need to make sure it works, because that will be the best way to convince the ministers of health in the other countries. You know, we can advocate, we can talk to them, but if we don't show it really works and improves the delivery of services in their countries, it will be very difficult to convince them. So I think, you know, I really I encourage the students to take full advantage of this program. And I have to say, it's a two-way, it's going to be a two-way learning process. We will be learning as we do this. And we will be learning from many of the students. Mona was mentioning some of the criteria. So you know, many of them are coming from experience in primary healthcare. They will probably also most likely inform us on how best to improve the course as we go. So it's a two-way learning process. This has to be a dynamic process as we improve the curriculum, develop things moving on. So I encourage them also to share with us, to share among each other, because we are creating also a community of family physicians in the region who will be, hopefully, this will be a program that will continue for a long time to come, sadaqa jariyah, as we say in Arabic. So it will be, I hope that this will be a sustainable program, speaking of a sustainable tomorrow, and that it will fill a major gap in our capacity in the region. So thank you again for all the speakers. Thank you to all our partners, and best of luck to the students and to all of us in implementing. Thank you very much.
Thanks a lot, Dr. Rana. And from the Arab Board of Health Specialization, we have Dr. Jawad Al-Sharif, the Deputy Secretary General. The floor is yours, sir.
Thank you, sir. Thank you. Your Excellency, dear Professor, my colleague, we are very pleased to participate in this ceremony. Actually, the main goal of WHO, the main goal of all international organizations and the Arab Board is to improve the health services. In Arab Board, it will be through training, qualifying, and developing the specialists. It is not a closing remark. Today, we are announcing the first academic day of this diploma. It is through an active partnership between Arab Board and WHO, between Arab Board and all international organizations, WONCA, UNICEF, UNAIDS, UNHCR, and UNFPA. Actually, now the first cohort, more than 200 trainees, more than 50 tutors or trainers, and the academic curriculum is there. So we are very happy to start today the first active day of the academic, and academic being the curriculum, but it is a professional diploma. This is the first cohort. Sure, we will have a lot of feedback from the trainees, from the trainers, from the training center, and in this way we will develop the second cohort. And finally, congratulations for the trainees by this support from all organizations. Thank you for your time. Thank you, sir.
Thanks a lot, Dr. Sharif. The last but not least, for my dear colleague, Dr. Awad Matariya, Director of Universal Health System. Over to you.
Thank you very much, Dr. Hassan, and thank you, really, colleagues, for all the efforts that have gone into developing and finalizing and now launching this regional professional diploma. I mean, it's a day to celebrate. It's a day to feel all proud about. I know that Dr. Anna has mentioned that this is a victory for WONCA. I think it's a victory for everyone that we see this regional professional diploma being finalized and being launched, and already seeing candidates being enrolled. And hopefully, as it was mentioned by Dr. Jawad, that looking forward to 2 years' time to come together and to celebrate the graduation of all the candidates, hopefully, who are enrolled in this diploma. I was really touched by several comments, remarks that were made by some of the presenters. And I would like to take maybe one of them, which was stated by Dr. Ghassan when he was making the distinction between family practice or family physicians and general practitioners. Because oftentimes we confuse the two and we consider GPs are the family doctors. I think there's some reality in that, but what he has put in his last slide, that it is the addition of a state of mind, and it is the addition of being system-oriented. So I think this is what it is about. So beside all the training, beside all the technical materials, it is the state of mind. It is how to change our perspective, even going, if you allow me, Dr. Hassan, going beyond being patient-centered to be people-centered and person-centered in terms of a profession. But so that state of mind is something that might not be taught in a classroom, might not be taught in an online lecture. It is something that one has to cultivate and to build it from the inside. Dr. Hajar referred to some of the missions that we were undertaking together recently. We are just coming back from Somalia, and we are still, I mean, I tweeted something after leaving Somalia that I'm leaving the country and my heart is staying behind. Because what we have seen there is really heart-shocking, heartbreaking. And if all what we are doing and throughout all these initiatives, being Asian professional diploma or helping countries developing policies, Hajar referred to the Salalah Declaration, does not translate into services delivered to people when they need them, where they need them, in the good quality that they need them with, then there isn't anything that you are doing. And they are not serving the purpose of why you are existing as an organization. And I think I can speak on behalf of all the partners who are behind this initiative. Next week, we are having our regional committee, so our annual NISTIA meeting. Will be presenting a paper to advise our member states, our policymakers, our ministers of health of the region on how to rebuild their health systems moving forward. And we are bringing in the agenda of building resilient health systems. We identified 7 regional priorities to work on, and the second one is related to building primary healthcare-oriented models of care. So I would like to see these, you as family practitioners, as family physicians who would graduate from this program, being part of this model of care. So it's part of a system that would need to have investment in all its elements. So it's not only the training, it's not only an individual, but it is the whole system that is coming together. Again, it is really a privilege to be the last speaker maybe today, but it is a wonderful opportunity to be with all of you and wishing you all the best as you go into this wonderful adventure all together. Thank you very much. Back to you.
Thanks a lot, Dr. Awad, and thank you for the panel member and the participants. Actually, it is really a historical day, and it has been one of my professional career objectives to establish a professional diploma in family medicine in our region. Thanks a lot for everybody. We are looking forward for more successful joint collaboration with the primary health care partners. And before we are going to say goodbye, can everybody put the camera on so we can get a group photo, please? Camera on for everybody. We are on. Don't worry. We are on. Yes. Are we? Yes. Okay. Ahmed, can you take a group photo? يعني خد 2 3 كده عشان الحبايب. All right. Done. Okay. Thank you, colleagues. Thank you very much. Goodbye.